March 21st is observed as World Down Syndrome Day, and I'm Dr. Preethy, Pediatric Consultant at Lourdes Hospital, Ernakulam. As part of our efforts to increase awareness about this condition, today I would like to share some information with you which I hope will be helpful. Now, what is Down syndrome? This is a genetic disorder. More specifically, normal human beings have 46 chromosomes in their genetic makeup, whereas a child with Down syndrome will have 47 chromosomes, of which they have an extra 21st chromosome. So children with Down syndrome have some amount of intellectual disability, and they are very easy to identify because they have a particular characteristic facial appearance which we call a mongoloid facies. They also have obvious defects in other limbs and also in other organ systems, more specifically the cardiac system. They have issues with endocrinological aspects like hypothyroidism. They are more likely to have blood disorders, especially leukemias, and more likely to have problems with the immune system, and they might get recurrent infections and need admission. They also have early onset of Alzheimer's disease. Having said this, I must emphasize that no child with Down syndrome is similar in capabilities or will develop the same complications as another child with Down syndrome. Hence, it is of paramount importance that anticipatory guidance is tailored to the needs of every particular child with Down syndrome, so that screening, evaluation and care can be given which is appropriate for that particular child. Most often, children with Down syndrome are happy children. They love to listen to music and are very fond of the company of other children. But they do get cranky and can have behavioral issues, especially if they have some other disorder, they develop any of the complications associated with Down syndrome. So a child with Down syndrome should never be isolated from their peers, but should be encouraged to mix with all other children and develop their capabilities as best as they can. As I mentioned earlier, Down syndrome is a genetic disability. Now, this extra chromosome that occurs in this child is usually said to be associated with an advanced maternal age at diagnosis. So now if we take a 25-year-old mother, there is a likelihood of 1 in 1,200 that she will have a child with Down syndrome. Whereas when it comes to the age of 35 years, the possibility drastically increases to about 1 in 350 pregnancies. And so for a 45-year-old mother, this same likelihood will increase to 1 in 30 pregnancies. So advanced maternal age is a very important factor in having a child with Down syndrome. However, it is also possible for a young mother to have a child with Down syndrome because a specific chromosomal defect called translocation of other chromosomes to the 21st chromosome can occur, and this can be transmitted to the child. So a younger mother, even in fact the father, can transmit a translocation defect to the child. So in every child with Down syndrome, it is important that they undergo a proper genetic screening. Now, once the genetic screening brings up something like translocation, the parents should also undergo a genetic evaluation. And if a translocation is detected in either of the parents, the parents must undergo genetic counseling, because the possibility of having another child with Down syndrome is much more as compared to the general population. So also, any woman who wishes to have a baby must realize that it is not because of something that you do or do not do during your pregnancy that you have a Down child. The defect has occurred before conception. So if you are planning to have a baby at an advanced age, do go for genetic guidance and counseling before you have the baby, because there is a risk of having a baby with Down syndrome as your age advances, and counseling can help you understand the likelihood as well as the problems associated with having such a baby. However, it is possible to give a child with Down syndrome a very fulfilling and good quality of life if we are able to detect the problems early and manage them properly. I hope this information will be of help to all parents who have children with Down syndrome, as well as those who are planning to have a child, especially if you are in the higher age group. Thank you.